With that, I am going to turn the time over to Corey to get us started with our webinar, Sharing Information and Data During a Pandemic.
Thank you. And welcome everybody. I appreciate you attending. I think we've got a really good lineup today from some of the other groups as well. So again, I'm Corey Ricketson with Pulsara. I've been in the healthcare industry for 25 years. Background was as a paramedic, and then I've been in the healthcare IT space now for 15 years. So what is Pulsara? We are a mobile application that helps connect teams across organizations in the healthcare space. And I'm going to talk to you specifically about how Pulsara is helping right now with the pandemic. So if you look at typical run-of-the-mill EMS to hospital communications historically, that looked a lot like an ambulance talking to a hospital directly through an 800 megahertz radio, perhaps a cell phone, something like that, but just direct communication. Well, we're going to talk about why that radio communication directly from EMS to a hospital in COVID times is probably not the most responsible way to communicate. So this does offer a failing point. So let me explain. With COVID specifically, which by the way is sort of the new normal as we're finding, is that a lot of the precautions, a lot of the methods that we've put in place are what are going to look long-term for the healthcare industry in general. So with this, some of the failing points are, if you're talking on a radio, that's simply just not a secure connection. We know that you're not going to give protected health information over a radio. There are folks out there with scanners. There are people in the emergency department that can overhear that type of communication. It's just not something that is a best practice to be shared like that. So that's number one. Number two, we all have a lot of PPE on now, and some folks in the field have half-mask respirators, APRs. Those do not lend themselves to really good verbal communication. You sort of sound muffled like this. And so nurses on the other end cannot hear that audibly very well. And then this is a big one. We know that in these times, collaboration is key. Being able to bring physicians in on a line, or public health, or mobile testing units, people to be able to collaborate to figure out the best thing to do for patients is a best practice. And so being able to bring those resources in to collaborate on that patient's treatment is the new norm. We have noticed acutely and very quickly that video telehealth is a huge need for the industry in COVID times. And so we can't be right next to each other all the time. And so we'll talk a little bit about how the solution helps leverage that as well. And then finally, we know that the surge is a very real thing in regions, and sometimes we may overwhelm one hospital versus another. And so we definitely don't want to do that. We want to be responsible with our hospitals and be able to load balance appropriately. So if we look at this and how our solution is helping, we do have a HIPAA compliant, just meaning that there's protected health information. We've gone through all the checks and balances to make sure that that's as protected as possible. We do have a telehealth solution that is a part of our application. And that's not just between clinician to clinician. So let's say that an ambulance is at a house, they could bring in a physician from a remote location and have a telehealth consult there. But it also could be all the way back at the dispatch center when the patient calls 911. Through our application, we can actually send an invite to the patient. They can click on the text message invite, and then it opens up their phone as a telehealth device so that we can bring in physicians and other resources in order to really figure out what does this patient need. And then this is all one unified channel. So instead of that one-to-one communication that we just talked about, where an ambulance calls a hospital specifically and directly, we can bring in multiple people into group chat situations and being able to collaborate and leverage some of the things that we're talking about. So there's a term that I want you to understand before we go into the next section. They call it a MOC, but ask for Tracy folks, FEMA, this has become an accepted term. And what a MOC is a medical operations coordination cell. This is very important for regions, as the MOC helps to coordinate not only physical assets, such as PPE and other resources that regions need, but it also does serve to help move patients to the right places and help with that load balancing. So as we talk about the MOC, the Medical Operations Coordination Cells, I'm going to show you how you can leverage Pulsara in order to effectively utilize a MOC. So if we were to talk about, and I'm not bringing up the state of Texas for any other reason other than the fact that I live here, but if I wanted to load balance across a vast space, or even scaling nationally, if I'm an ambulance and I feel like I need to take a patient to a hospital, but I want to seek guidance on where's the best place to take this patient because we're in a surge capacity situation, I can, instead of sending a message to a hospital directly, I can send to a regional MOC and say, hey, I have a patient that needs a landing place. And that MOC is going to act as an air traffic control. And they're going to say, okay, here's how bad the patient is. Here's the resources we feel like are going to be needed for that patient. And here's the most appropriate location for you to transport to. That's responsible patient movement. Perhaps this region is full and staffed to capacity. We don't have any more beds. We need to send you somewhere else. So I could seek the guidance of a statewide MOC as well to say, we need to load balance. Where's the next place that can accept a patient? Because they have overreaching or overarching sense of where the capacity is, they could then pull the next regional MOC in line that would be responsible for getting this patient to a final destination. And then we can link that final destination into the same channel. So if you look at this diagram, we have an ambulance, we have a statewide MOC, 2 regional MOCs, and the final hospital all in the same channel collaborating on this patient. If they needed to seek the guidance of the federal MOC, they could do that as well. So this is what the typical patient journey looks like. And this is a lot of disparate communication, a lot of endpoints. It's picking up a phone, putting down a phone, picking up a fax, looking at it, sending a text message to somebody, but it's all one-to-one communication. We're going to get rid of that, and here's how we're going to do business. So if I'm an ambulance and I need to start a patient journey, I'm going to create the channel, and then I'm going to start to build my care team. I'm going to consult with my local air traffic controller, medical control, or MOC, and I'm going to say, I need a landing place for this patient. At that point, they may need to add other resources into the channel. Maybe it's a liaison from the hospitals. Maybe it's on-call medical directors. Maybe it's public health. But once we figure out the right thing to do for this patient, which, by the way, may not be a hospital. It may be an alternative destination. It may be a lot of different things that don't look like the traditional go to the hospital. In COVID times, we've really started to think outside the box and bring in other resources. So at that point, we may need to add the destination into the channel, but we're all in the same channel now. We're leveraging live video. We're leveraging group chat. We're leveraging images. And it's a great situation to be able to collaborate. So in final, I'm just going to show you a quick kind of screenshot of how the application looks because you want to see what the UI is. And so as you can see, the medics on team are just starting a quick channel. This could also be an urgent care. This could be a doctor's office, a nursing home. Anyone can start the channel and seek the resources. At that point, they may start to add the images that we talked about. So these are things that are going to help the clinicians on the other end take care of this patient, pre-register early, and start that process much earlier than previous. So with that, I'm going to wrap it up and say this has been working very effectively in large regions in the United States, from Austin to Colorado Springs. A lot of places across the nation have leveraged this, and it is expanding rapidly. So I appreciate your time today. And obviously with a solution like this, you're going to need some good connectivity. there are solutions out there that can definitely help with that, which is kind of why we're on this webinar today. So I'd like to, at this point, turn it over to Drew Delaney to talk about how we might be able to help with connectivity.